So our first speaker is Dr. Michael Gell. Dr. Gelb is a world-renowned TMJ and sleep specialist with practices in both New York City and White Plains, New York. He received his DDS degree from Columbia University College of Dental Medicine and his MS from SUNY Buffalo. Dr. Gelb is co-author of GASP, Airway Health, The Hidden Path to Wellness, and the co-founder of both the Foundation for Airway Health and the American Academy of Physiological Medicine and Dentistry. The Gelb Center was founded over 30 years ago by Dr. Michael Gell's father, Dr. Harold Gelb, and since then, Dr. Gelb has taken his father's findings to the next level through his Airway-Centric integrated therapy. He invented the ACG Airway-Centric system with the help of prosomnus sleep technologies. The ACG system is the first day and night dental appliance solution that offers an integrated approach to addressing airway issues. Dr. Michael Gell is dedicated to improving his patients' health by reducing pain, restoring, refreshing sleep, and transforming lives. Please welcome to the stage, Dr. Gell.
Thank you. It's a pleasure to be here. I do not have any financial interest of a product in my talk or with any companies offering grant monies for this continuing and medical education program. I have to start with that. Now, it's a pleasure to be here live. I think we've all been waiting for this. Thank God, Sarasota in Florida, what a nice place to be, and you're a fantastic group, and I'm really honored to be here. So I'm going to tell you about my journey, and I'm going to tell you about a potential journey that maybe some of you are on to becoming an airway dentist. There's a lot of familiar faces here, so I know that a lot of you are well on this, and I see my mentors. You'll be hearing from Joy Moeller after me and Bill Hang, Jill Umbrella this afternoon, so people that I've learned from and that we've worked with for over 30 years. So the journey to becoming an airway-centric dentist, and I love the play on words, I love airway-centric because we're going away from the concepts that we learned in dental school, but we're honoring them at the same time. So centric relation dentistry, you can still be a centric relation dentist, I think, and be an airway dentist, and that's a great conversation to have. So we talk about the TAO, the path. So what Lane Martin and I have done, and what we've tried to do is integrate TMJ, airway, and orthodontics. And you know, Bill Hang's been talking about this, but some of us are a little slow to pick up on it. We're now actually growing the airway. So the resolution of the problem has really shifted now, and it's really picking up steam. You know, Joy will talk about getting rid of it as an infant, and then Bill and I'm going to try to kind of integrate this all together and be a good opening act. So we talk about wellness. Better put my glasses on. So it starts with children. You know, Christian Guilleminot, and we're going to talk about Guilleminot, but this problem really starts at birth. A lot of these kids are born and they're mouth breathers, like I was as a kid, and they're born as mouth breathers. You don't have to wait for the tonsils and adenoids to hypertrophy for them to become a mouth breather. They're born with low tone. All preemies are born as mouth breathers. They're born with tethered oral tissues. They're born, as I said, as mouth breathers. So for me, after hearing Karen Bonnick, and we were just talking to Bill and Debbie in 2012, we know a lot of this is about the optimal development of the prefrontal cortex in our infants, in our children, before age 5. So if you think the orthodontic community has done a great job of saying, now we're going to intervene at 8 or 9, too late. We want to intervene, like Kevin Boyd says, at 2.5, at 3, as early in life as possible. We want you to challenge assumptions that you learned in dental school. Most people I see in my New York City practice are still coming with night guards that are made in terminal hinge. They're still coming in with night guards, and some people like sleeping in them at night. People are comfortable in them. But we've got to challenge assumptions. We've got to think again. We see a ton of TMJ in young women after puberty. So estrogen plays a big role. My 2 big high school and college women, and then again around perimenopause. We're going to talk about upper airway resistance syndrome, something if you don't know about upper airway resistance syndrome, those are the women that keep coming back to your practice. They're clenching, they're grinding, they're breaking teeth. They've got cold hands and cold feet. They're always exhausted. They're fit. They run 5 miles a day. They do Pilates. They're on the Peloton. The whole COVID crisis, they're on the Peloton. They're not sleeping well. They're not getting down into deep sleep. They do not have sleep apnea, but they have upper airway resistance. They have flow limitation. They have disrupted sleep. And these are your bruxers in your practice. You can't stop them from bruxing. You don't know what to do. You offer magnesium citrate. You offer anything that you can think of that's more in your realm of how you would practice for the IAOMT. You can't stop them from clenching. So aesthetics, we do a lot with aesthetics. I'm going to talk to you about aligning data sets. We're going to talk about opening the airway, and then we're going to talk about growing the airway. There's a great book that I want you to look at and think about reading. It's called Think Again. And I think Rethinking Dentistry could have been my other title for this talk. Think Again. So the guy that founded Black Bear, he said, who would want to put an internet browser in a phone? That is such a, phones are, who would want to put it, why would you want to go on the internet? And so his design, no, we think it's going to drain too much of a battery, we can't do it. Steve Jobs, when they talked about making the iPhone, what's it going to do to our iPod? Why would we want a phone? Why would we want to cannibalize the iPod, which held like 1,000 songs? Why would I ever want to get rid of the iPod? Why would I want to do a phone that, do you understand? And his people had to say, no, we really think that this iPhone is going to be a big hit. It can still carry all the music, but it'll be like a computer. And finally, Jobs relented, and that was the birth of the iPhone. But we in dentistry have to start to rethink some of the things that we held valid. The book Breath by James Nestor really does that in a great way. And you've seen a lot of patients, Bill and Debbie, I've seen a lot of patients. If you haven't read the book Breath, right, Joy? If you haven't read the book Breath, read the book Breath. I hate to promote my own book, but you could read my book or read Breath first and then read Gasp, and very happy to have written that with Howie Hinden. So we're talking about a solution, a day solution, and a night solution. And sometimes when you hear lecturers talk about sleep and airway, they're talking about what happens at night. But what about how you function during the day? What about your performance during the day? What about your attentiveness? So I think we have to have a daytime during COVID, clenching during the day. How about jaw pain during the day? How about neck aches? How about headaches during the day? So when we talk about a complete health practice, I put IAOMT, AAPMD, and AOSH. And I'd say potentially these are 3 groups that could work well together. And I certainly want to pursue that kind of conversation because all of us are into a complete health type practice. And I think that when we talk about TMJ, airway, and ortho, we could be talking about work, play, and sleep. So in other words, we need to offer our patients solutions at work, performance, attentiveness, maybe relaxation. When they're playing, they want to have good performance, and we know about studies like that, right, with strength testing, performance, and then lastly, it's during sleep. So, Michael Balin, the Balins are here, Richard Fisher, and a lot of Bill Hang and Debbie Hang. So my folks, my mother was a myofunctional therapist. My dad's still alive. He's going to be 96, so I put this up here, to thank them. Wouldn't be here without them. So it's a step-by-step process, this journey, that starts with newborns and infants. As I said, we address ADHD and ODD, oppositional defiant disorder. If you haven't seen Finding Connor Deegan, please look at that. And so we know from Steve Sheldon's work that we can get approximately 50% of kids off of Adderall, Vyvanse, and drugs they're taking if we just get them to sleep through the night. So if you have any cousins, if you have friends that have kids, I'm sure you guys are all looking at this, but be aware of that. TMJ, headache in girls, we're going to talk about posture, we're talking about the Gelb 4-7 position. And you need a team. You have to assemble the right team to do it. So whether it's finding someone who can do frenectomies, working with occupational therapists that work with suck, swallow, and breathe. So a lot of the preemies, when they're born, they can't suck, swallow, and breathe. So they can't breastfeed. They can't suck the nipple, swallow the milk, and breathe through their nose at the same time. Believe it or not, that's not such an easy thing to do. You got to be able to do 3 things at the same time, and a lot of infants can't do that. A lot of preemies can't do that. So now the OTs have always been involved in feeding, but you know, the OTs don't know anything about airway. They don't know there's an airway there. They're all feeding, feeding, feeding. So somehow we've got to cross-pollinate these different groups. So speech-language pathologists getting in, working with OTs, guided growth appliances, tonsils and adenoids from your ENTs, myofunctional therapy, certainly Joy's going to speak about that. ACG day and night, expansion ortho, I love the general dentist doing that, airway devices, and then growing the airway. And then the physical therapist, I don't want to leave that out. The diaphragm, how you breathe, stop breathing with the accessory muscles, so teaching someone the right way to breathe. So believe it or not, in your community, there are airway-centric physical therapists like Brad Hilden, like Ryan Johnson, Greg Johnson, Ron Harushka. So you'll find in your community physical therapists that you can work with to teach your patients how to breathe, to expand the rib cage, to be able to allow them to take a breath. And so we start with the journey with infants and children, identifying risk factors. We don't want to miss Steve Carstensen, Susan Maples, the Endeavor Project. They're working on the questions that we should be asking. And it's about brain development. It's about starting myofunctional therapy really early. And start earlier than age 5. So, you know, a tribute to Christian Guillemin. Guillemin talked about this facial dysfunction. These kids are born with this dysmorphism. So the children is born with that high narrow palate today. The child is born with the tongue tie. It's up to us to look in that and to appreciate it. They're born retrognathic. This is the work of Kevin Boyd. He talks about the craniofacial nasal-respiratory complex. And you can see that some of these infants, you can see how retrognathic they are in utero. And he talks about Chicago heart, identifying crossbites, hyperdivergent, hypertrophic tonsils and adenoids, incompetent lips, constricted arches, airway anatomy, grinding teeth, obese children, which we're aware of can increase the incidence of airway, high vaulted palates, eye appearance, showing the sclera, anterior open bite, retrognathia, and tongue ties. So we know at 6 months to 12 months of age that the epiglottis descends and it leaves a vulnerable area here about 1.5 inches. So if you look at Lieberman's work, we're going to show you this with James Nestor in a little bit. But as our tongues have gotten bigger and as our midface has retracted, our spinal cord has come forward. As our midface has retracted, as our brain got bigger, we became upright, and our foramen magnum, our spinal cords, our cervical spine has come anterior. What's left in the middle? The airway. So in many, many cases, more than you would imagine, the airway is going to suffer right here. It's going to collapse. And so Christian Guillemin talks about establishing nasal breathing. The APMD had a webinar on Tuesday night. It was all about the importance of nasal breathing. And so more and more we're trying to establish, people are taping their mouth. You know, Bill's been taping for a long time. People are taping their lips now. It's becoming like the thing to do because it actually improves how we sleep. So we want to establish nasal breathing. That's our ultimate goal, along with adequate craniofacial and airway development in children, in light of everything that we just talked about. So we're identifying these things in our infants. We're seeing a lot of these high, narrow palates. These kids are failing to thrive. They're lethargic. And so the big 3 would be frenectomy, breastfeeding, mouth breathing begins even at birth. And these are the things that Guillemin identified in his article for what he sees very early on. And in this corner, still undefeated, Frank's long-held beliefs. So in dentistry, we'd rather hold on to our beliefs. It's very hard to unlearn something and relearn something new. So if we weren't taught it in dental school, which sounds like my dad, Or if we were taught the opposite in dental school, it's very, very hard to rethink and to unlearn. It takes a lot of humility to say that I was wrong. And so this is the appearance that you're going to see hygienists, assistants. Your front desk could be identifying this person before they walk in. Doc, we have an airway case coming into room 1. I run the front desk. I know more than some of the doctors, okay, in the United States. So I want my front desk to be saying, my DOFI, my Director of First Impressions, my DOFIs, you guys could be, anyone, I always say, any one employee could save the whole office on any given day, right? Just remember this, remember that, did you guys do this? So before he even walks in the front door, that's the signs and symptoms of a mouth breather. The bump on the nose, the retrognathic, the maxilla is retruded, the mandible is retruded, the posture gets forward. And so I think we're aware of this type of pattern. You can't forget Karen Bonnick's work from 2012. Avon longitudinal study, 11,000 kids over 6 years. So if a kid was just a mouth breather or just a snorer, they didn't even have to be an apneic. By age 4, they had 20 to 60% more behavioral difficulties, inattentiveness, hyperactivity, anxiety, depression, peer-to-peer issues, conduct, aggressiveness, rule breaking, impaired executive function. David Gazal calls it executive dysfunction. By age 7, it was increased by 40 to 100%. These are things that all of us in this room should be picking up when the kid is 2, 2.5, 3, 3.5, 4. Noisy breathing. But you got to go in the room, you got to realize that mouth breathing is not cute. Now, if you haven't read the book, if you haven't seen this book by Howard Stupak, we have to rethink a lot of what we know about ENT. Because what he's saying is that hypertrophy that occurs in the tonsils and adenoids, which is this pink tissue right here, it really is the negative pressure that just happens to us because of our dysmorphism. So you don't need inflammatory elements to cause increase in tonsil and adenoid size. It's going to happen because of nasal breathing, or rather because of mouth breathing. So as we increase the mouth breathing, we get the long face syndrome, the bump on the nose, the gummy smile. And as we increase tone, we get the square jaw. And so this is just one way to think about it. We want to establish nasal breathing. So we want to establish nasal breathing because when we don't, when we breathe through the mouth, we start to get changes in the airway and we build up that negative pressure. And so what we want to do at night, like Bill Hent does, we want to tape our lips. We want to follow what Joy Moeller teaches us. We want to establish tone. We want to get that tongue up to the palate in the proper, ideal rest posture. And when we keep the lips together and the tongue's up to the palate, you see how the soft palate attaches on the back of the tongue? The minute we open our lips, the jaw drops back, we lose the seal between the tongue and the palate, and now we can't breathe. The airway's blocked. Now the airway's blocked. The soft palate drops back, the tongue drops back, the airway's blocked. Now we have sleep-disordered breathing. So that's a diagram of what happens when we start breathing through our mouth at night, when we lose the lip seal, when we lose the tongue posture, when our lips come apart, when we have low tone. And so this is a diagram. So if you read Howard Stupak's work, it really discusses what Guilleminot was talking about and really supports Christian Guilleminot's work. So again, we've gone through what happens in children. It might be bedwetting, frequent awakenings, nightmares. I wet my bed until I was 6 until I had my tonsils and adenoids out. So it's as simple sometimes as tonsils and adenoids. We want to screen for sleep apnea. What I'm going to tell you is when you go back to the office on Monday, 50% of your patients in hygiene had this. So what am I talking about? Look, I'm in New York City. Everyone's on antidepressants, okay? So if people have panic attacks, I want you to think sleep disorder. If people have anxiety, I want you to think sleep disorder. You can do the stop bang, but if most people I talk to are not refreshed, you don't ask someone, are you tired? Look, men are in denial, women speak in code. Men are in denial. No, it's not my problem. I don't have a problem with snoring. I don't hear it. And then women say, nah, I purr. I don't really. And then, women they're gonna, but could you be more refreshed? Oh yeah, I can be more refreshed. So you have to ask, it's how you ask the question. Don't say, are you tired? You talking to me? I'm not tired. Yes, I can be more refreshed. Are you taking any, do you take Tums? Are you taking Nexium? Are you taking prescription medication for your stomach, for your GERD? Do you have high blood pressure? Arrhythmia's got to be like very close correlation. If you have someone who has arrhythmias, they need ablations, they need cardioversion, chances are they have a sleep problem. I mean, you've got to rule that out with a polysomnograph. Difficulty concentrating. So in kids, we call it ADD, but once you get past age 20, 25, we just say he has difficulty concentrating. Okay, because it wasn't diagnosed when I was a kid. If you have trouble, remembering things, and you're going to see the neurocognitive issues start to add up when you start talking to your 40-year-olds or 50-year-olds, and that might be a sign that they're not sleeping well. Weight gain, and then irritability is another one. So we talk about school, play, and sleep. This is like really Karen Bonnet's work. And so when we talk about the path, the TAO, the reason why people are coming into your practice are two things. They're breaking restorations, they're grinding their teeth, and during COVID, they have sore jaws, they're getting more headaches. We don't know if it's the COVID or the stress from the COVID, not sleeping well, increased grinding, but I was talking to Lou Azara, they're going from making 300 to 400 night guards a day to making 1,000 night guards. That's because all of us are sending in so many cases because so many people are grinding their teeth. So the way the patient presents to your office that has an airway problem, women speak in code. They're not going to come and say, I have an airway problem. I just want to tell you right now at the front, no, my jaw's really hurting me. And why is the jaw hurting you? You're clenching. Why are you clenching? Perhaps you have a narrowed airway, which is increasing your clenching because you're trying to clench in an attempt to open the airway. So again, it's teenage girls, it's young women, it starts at birth. It's an estrogen issue sometimes it's stress, trauma, posture, and orthodontics. So the etiology, obviously, if we take out teeth or we do interproximal reduction and Invisalign and we close spaces, we can close the airway, we can make TMJ worse. We talk about the appliances, ACG day, ACG night, ACG full lower, sports guards. And so we have the ability now to take masseter muscles which are hypertrophic, just to show you what's possible and to show you the effect of what reps. So you're doing 100 to 200 reps a night, and every time that you're clenching 250 pounds, those masseters are getting bigger and bigger. And so the face gets wider this way, and it gets shorter in the lower third facial height. So you lose lower third face height, and you gain masseter. So we go back. Dentistry has historically been a retractive profession. We'll say that it was inadvertent. No one planned it that way. But starting at USC in 1924 with Stewart and Stallard, and some of the older guys in here will remember the fathers of mythology, they had to shove the jaw all the way back. They called it terminal hinge. They called it rearmost, uppermost, and that was centric relation for many, many, many years. And then a guy named Peter Dawson came along, and we were arguing about the date, but roughly 1982, 1985, and he said, no, it really should be anterior superior. Now, my father and Bill Farah were saying that since the 60s. And so when we talk about what is the ideal position for optimal health, what's the optimal, I know the AACP, Michael Balin, Richard, the ideal position for the American Academy of Craniofacial Pain is concentric to Gelb 4-7. So you just have to think about where the jaw should be, and I think you'll see with some of James Nestor's stuff why when we talk about health, the position that's going to create an open airway is probably the best position. Remember, airway trumps everything else in dentistry. And Howie, your detoxification Everything that the academy is based on is going to work better when you're getting oxygen into the system. I guess it's common sense. And so when we talk about the TMJ, Airway-Centric Tmj Philosophy, what used to be thought of that TMJ was most important, we're really thinking that when we're opening the airway, when the jaw comes down and forward, what does it do? It opens the airway. When the jaw goes back, what does it do? When the mandible goes back, it closes the airway. So in talking about an overall philosophy, I think that the airway philosophy probably even trumps TMJ. And people like Bill Hank, I say, if Bill gets a child early enough and expands the maxilla, the child's probably never going to get TMJ. So in other words, if you free up the mandible, if you expand the maxilla enough, you're not trapping the mandible, you're probably going to alleviate most TMJ problems in the future. And that's my job, is to put myself out of business. So I would love it if everyone did that. So this shows you that as you bring the jaw forward, you recapture the disc. At the same time, what you're really doing is you're opening the airway. My dad would go to fatigue conferences. He said, yeah, I fixed the TMJ and the patient was less fatigued. Well, yeah, he fixed the TMJ, but when he kept the jaw down and forward at night, what was he doing? He was keeping the airway open. So serendipitously, we didn't realize it at the time, but really the TMJ treatment was also opening the airway. The patients are going to come in with popping and clicking, locking and grating, sand, bone on bone. They're going to say they have jaw pain. They can't open widely. But when you question them a little more, and by the way, Bill, this is a finished ortho case. It was done by a pediatric dentist. This is a finished case in New York City by a prominent pediatric dentist. Nothing against pediatric dentists. But when you question this young girl, this 16-year-old and her mother, I've had ADD forever. I'm distracted. I don't finish tasks. I have fluency. I've had speech issues. My mother says my daughter's around really tight. Now, there's always that mother-daughter conflict at around 15, 16, okay? But my daughter can be irritable. Now, I'm thinking to myself, okay, I won't say anything. The dentition doesn't look too bad. She's certainly retrognathic. Jaw's too far back. But, I'm not really thinking, So now I see the condyles are bent. The condyles have bent like a hockey stick to fit in the fossa. So with our Vatec now, we're getting down to like C7. We're getting down to the first rib. So now I start to see some real asymmetry. I don't know about you, but for those of you, I work with physical therapists a lot. I work with some whatever you want to work with is fine, but when you see a neck like that, it's got to be a dentist working with someone who treats the cervical spine, okay? So now that we're getting down past like C3, C4, you don't see much scoliosis, but when you go down to C7, you can really see the continuation of the scoliosis. So I would encourage you to get a larger field of view if you can. Now, I start to look at this, and I see a little bit, but now when I really measure the airway, it measures less than 120. It's measuring 71.6. I'm thinking to myself, of course I'm going to get rid of the clicking. Of course I'm going to help with the jaw pain. Of course I'm going to do all the TMJ stuff. But what if I can get rid of all her ADD? What if she doesn't have to be wound tight her whole life? What if she doesn't have to be irritable her whole life? I'm a dentist. I never imagined I'd be saying this when I started this 37 years ago. I never thought it was possible. I didn't go into TMJ to get rid of people's ADD. I didn't know I could do that. But you know what? We are the best specialty to do it because the dentist control that. So the last 5 things is what keeps me coming back to the office. The TMJ stuff I learned how to do 20, 25, 30, 37 years ago. I took a master's program in it, but I learned more from studying with the people that do it every day, studying with the people that couldn't stand my dad, study with everyone. So that was about half the country. And then study with the other people too. But if you can help this girl with these 5 things, I think you're doing a great service. Because people coming in don't have a primitive maxilla. You talk to Bill. Bill Hank's going to show you this, clearer than I'm showing it to you. But the people coming in today don't have those kind of arches. Their maxillas are narrowed. 88% of all maxillas are too far back. I think it's more like 95%. So we see a V-shaped upper arch. We don't see a U-shaped. The tongue is always down. The tongue's not up. There's more tethered tissue. There's more epigenetic factors. There's more epigenetic, pollution, preservatives in food, glyphosates, pesticides, right? This stuff has been going on since the 50s. Things started to get bad in the 80s. Now we're in 2021, and things are really not good at all. It's time to reverse that. So low tongue rest posture may lead to high narrow palate. And I just didn't put this in for joy. Myofunctional therapy is now preventively really gaining hold in this country as a way of preventing these problems starting at an early age. And you're going to hear more from Joy. So you don't have to be Joe the fat boy in Dickens. I can find thin women in my hygiene schedule, Shirley, thin women with big tongues and small upper jaws that are going to have narrowed airways. And so the transformation that I can achieve by fixing the TMJ, opening the airway, it's an old Jewish recipe, part Italian. Little oxygen, little deep sleep. Taste it? A little more oxygen. So if you're good and you work with your female patients, if you get a woman to sleep through the night, you're going to see remarkable transformations. And then if you work with an orthodontist or you work with a dentist, you can stabilize that. And also work with your myo, your physical therapist. Everyone wants to know how to take the bite. We love phonetics. We think phonetics is a good way to go. You know, Bill's made us very aware of the long face. We don't want to make the face longer. So we're really doing ortho in most of these cases now to try to finish the cases. In kids, we go right to ortho. So this is what we do to take the bite. We talk about an ACG day and an ACG night. So we do a lower appliance during the day to decompress the jaw, alleviate pain, and it's also for mindfulness. You want to remind your patients today during COVID, lips together, teeth apart, tongue up to the palate, lips together. It still works 50 years later. So in terms of, and then you can teach Buteyko breathing, or you can teach Wim Hof, or you can take this as far as you want to in terms of mind-body. This is the best way to integrate mind-body medicine. For me, this is day and night, mind and body. Day and night, mind-body. And you can go as far as you want with the mind-body stuff. If you want to go deep into Buteyko, if you want to go into breathing techniques, you can make that a big part of your practice, and you're going to do great. And then the nighttime, look, this is the health night guard. We're going to talk about that. So there's been a shift. There is a shift. We're thinking again. We're rethinking. It's called the shift. So we're going from just looking at teeth, which I think, we can train someone to do that in 5 years. Now we're looking at signs of the teeth. We're looking for a dental solution to a medical problem. We're looking at airway problems. We're looking at TMJ problems. And we're trying to integrate TMJ, airway, dentistry, and orthodontics. And I said, you've got to start with the medical history. So Monday, you're in hygiene again. This is for the hygienist. If they're on a reflux medication, I can't say this enough. I never cared as much about the medical history as I care right now. Because the answers are hidden. It said, look, what's the title of GASP? The hidden path. This is hidden. You're not going to go back to the office on Monday. If you are looking, I'm just asking you to be open-minded and think again, because I'm going to guarantee you that 50% of your patients on Monday are on reflux medications. I guarantee it. They're on antidepressants. They're on anti-anxiety meds. They're exhausted. I'm going to say 60 to 65 are going to tell you they're not refreshed. They're not going to admit they snore, because men are in denial, women speak in code. So, they may not, if they say they snore and they're tired, you got it. So look at the medical history, panic attacks. And then these women have cold hands and cold feet. The blood's not going to the rest and digest. The blood's not going to the gut. They're going to have irritable bowel. They're going to have stomach issues. The blood's not going to the feet. The blood's not going to the hands. The blood's going to fight and flight and sympathetic. So how do you get this type of transformation? I say to everyone, I'm the best cosmetic dentist in the country. Okay? I'm not going to show you a tooth. I'm going to show you eyes. I'm going to show you skin tone. I'm going to show you lower third face height. I'm going to show you nasolabial folds. It's the old recipe. It's the old recipe, Lewis. Little oxygen, a little deep sleep. You got to have deep sleep. You got to get good rest. What does sleep apnea do? What is airway resistance? It disrupts your sleep. So yes, the condyle is bone on bone. Yes, she had 2 rounds of orthodontics before she came to me. She's from Miami and New York City. And it takes about 3 to 4 months for the metabolism to change. It doesn't happen overnight, but over 3 to 4 months, the eyes open up, the oxygen, the oxidative stress improves, the endothelial dysfunction improves, sympathetic tone goes down, and inflammation, systemic inflammation is reduced. CRP, all your markers of inflammation, tumor necrosis factor alpha, interleukin 6, they all are improved. Now, this is a patient I treated 25 years ago. As the condyle comes down and forward, look how her skin tone changes. Look at the color of her skin and look how her eyes open up. Now she looks like she's about 65. Now she's going to get gray again. Her jaw's now going back. Her jaw's going to go back. She's getting grayer. Her jaw's going back. Her eyes are closing. She looks a little sick. She looks haggard. She's tired. Death. Going towards death. Aesthetics, airway, and inflammation. You're reducing, you could call yourselves anti-inflammatory dentists. You could call yourselves anti-inflammatory dentists because I don't know, I can tell you what I think you're looking at. You're looking at a totally different human being 5 months later. You're looking at more of a picture of health. Now, if you add what you guys know, if you add some nutritional, some homeopathics, if you detoxify this patient, she's going to look even much better than this. This is just with giving her some, restoring the lower third of her face and giving her better sleep. But was she irritable? On the picture on the left, yes, she was irritable. Was she tired? Yes, she was tired. Is she a great person? Yes. You just have to allow someone to sleep. You have to get someone to get through the night and get restful sleep. So again, it happens over 3 to 4 months. It's not going to happen in a week. But you're going to see these transformations happen if you start taking photos before. So the number one reason people are coming in, clenching and grinding, as I said before. TMJ, headaches, clenching, ear symptoms. And we know right now, if you haven't read this position paper, the American College of Prosthodontics, surprising, I know, came up with a great position paper. And it said practitioners should screen patients for sleep apnea before making a night guard. This is like the lowest hanging fruit. Lane and I like to talk about this. This is low hanging fruit. This is your average night guard. And so we know that when we take out tonsils and adenoids, we know that the bruxism gets better. Like when I had my tonsils and adenoids out, my bedwetting went away. When you take out tonsils and adenoids, clenching gets better. Is it that you're opening the airway? We think it has to do with your opening the airway. The risk factors for sleep bruxism, this is the journal Chest, the pulmonary journal. The number 2 things were heavy alcohol drinking and sleep apnea for causing bruxism. And Ron Pren, who works with Gerald Simmons in Houston, he believes that there's a protective function that when you're clenching, you're actually activating the genioglossus muscles, so that when you are clenching, it actually has a preventative effect. It opens the airway. I might need, oh, no, I think I'm back. So one of the signs of sleep apnea, look at all the dental signs. My friend over there. Oh. I'm on your side now. So now we see, look at the dental signs for sleep apnea. Maxillary constriction. This, I didn't write this, Gilles Levy wrote this. Retrognathia, maxillary constriction, overjet, overbite, big tongue. So again, this is in our dental wheelhouse. This is what we're looking at. This is where we work every second of the day. We work with the maxilla. We work with the mandible. The tongue, we're around the tongue all day long. Are we looking at how the size of it?
Are we looking to see whether it's blocking the airway? Those are the symptoms and signs of sleep apnea. I have this is the National Sleep Foundation, this model. It cost me like maybe $99. I show this model to every patient because it shows them how when their jaw goes back, the tongue goes back. When the tongue goes back, the airway closes. The airway closes, they don't get good sleep. They can understand it in 2 seconds. And it's funny that like in Toronto, it's illegal to reposition, right? In certain parts of the world, we know people like Stu, cost them hundreds of thousands. In this country too, people are still against repositioning during the day. Yes, if you don't know about it, come and talk to me afterwards. We reposition during the day, we reposition at night. And we use AM aligners in the morning so we don't change the bite. Practitioners should screen patients for OSA prior to fabricating a splint that increases the vertical. So when Lane Martin went to school, when I went to Columbia, I don't care what, you go to the University of Florida, Parker Mahan, Henry Grimion, great guys. When I had to pass the Northeast Regional Boards, if I was going to do a mouth guard, it had to be made in centric relation, kind of in a retruded position, centric relation position, shove the jaw back. So 90% of the night guards that I see just open up vertical. They don't protrude the mandible. What the American College, I can't believe this is coming from the American College of Prosthodontics, they're saying, because if you look at these references, if you look at these 3 articles, and there's not a ton of patients in these studies, but basically what it showed was that 50% of these patients, their apnea got worse when they wore a stabilization. I'll say it again. Their apnea got worse when they wore a night guard. Why? It takes up space. The acrylic is thick. It pushes the jaw back. It's entirely possible. So the AHI of the 3 nights, the average was 17.4. They were moderate apneic when they wore their night guard. So if I went on 60 Minutes, we're harming people in the United States. 90%, I would say, this study says 50%, I'll say 80 to 90% of the night guards that we're wearing every day in the United States are hurting our population, are closing airways. And so that's what a typical guard looks like. It's made in a retruded position. It's the way that you were taught in dental school. So I'm asking you to rethink dentistry. I'm asking you to unlearn and then to relearn if that's possible. Read Adam Grant's book. Because the primitive night guard, it does prevent tooth wear. It's not going to break your gorgeous laminates, Lane. However, we know that it has a 50% chance of worsening the airway. The modern night guard, the ACG Night, give you these promises. What if I could make you a night guard, Mrs. Smith, where you could wake up refreshed? You're a dentist. Yes. But what if I could make you a night guard where you woke up refreshed? I would love that. What if you could wake up in a better mood? You can affect my mood? Yes. That's what we do in dentistry. You can wake up actually in a better mood. What if you could wake up with no... I've been getting headaches for years, Dr. Gell. You're a dentist. Why are you treating headache? Well, look at my card. TMJ headaches and airway. Because we treat the muscles, the trapezius, the sternocleidomastoid, the masseter, the temporal. We treat muscles that refer up and pain into the head. People have forward head postures today. People are on phones. We see it with our chiropractors. What if you could wake up with no clicking in your jaw? What if you wake up with your jaw unlocked? What if you could wake up with no jaw pain? Those are the promises. And then we have these different splints. Somnus is one lab that makes them. Great Lakes is another lab. And so to be the Gelb 4-7 position. Doesn't have to be. Make it in any position you want to, but don't close the airway. Make it in any position you want to, but don't close the airway. This is upper airway resistance syndrome. I want to put a little music to this. But these are your ballet dancers. These are your women that are taking bar class. These are your women who are doing Peloton. And they're in such great shape, but they're exhausted. So I recommend this article from Elle magazine that my patient wrote, Rachel Comby. I give this out to all my patients. It's called An Awaking Nightmare. And it's after she had her 4th kid, it's what it's like to have upper airway resistance syndrome. It's a great article. If you can't find it, you can email me and I'll send it to you. These women have been diagnosed. This is the article for Avram Golden. This is what I love about. This integrates a lot of the things you're going to see in your practice. These women have they've been diagnosed by other people with fibromyalgia. In other words, their nervous system is sensitized. You could see people that are sensitized from mold, from mercury. Don't get me wrong, there's other things that can sensitize the nervous system. But these women can't breathe through their nose. They have resisted breathing. This is women speaking code. Yeah, sometimes a little hard. I'm congested all the time. You know the people using Flonase, and the next day they're using Afrin, and the next day they're using a neti pot. You know what I'm saying. This is my whole practice. They have irritable bowel. These are all chronic pain syndromes. They have what's called TMJ. They have bruxism. They get tension headaches. They get migraine headaches. They get anxiety, and they get depression. It's all part of the same thing. The nervous system gets sensitized by this thing called upper airway resistance syndrome. I give everyone this Avram Gold article, and I circle where it says anxiety, depression, bruxism, irritable bowel, because, by the way, if you don't breathe through the night, it increases intestinal permeability. It's called leaky gut. When you don't get good airway at night, it screws up your microbiome of your gut. So if you're trying to fix the gut, please fix the airway first. If you're trying to fix the gut, if you're trying to fix the microbiome of the mouth, we'll shut the lips at night and get the patient breathing at night. These women have cold hands and cold feet. So these patients have low blood pressure. They don't have high blood pressure. They have actually low blood pressure. So it's very different than sleep. They don't have any oxygen issues. They don't have apnea. They get up, they feel faint. They're dizzy. And I think you know the patient I'm talking about. They look great, but they're lightheaded, low blood pressure, dizziness, migraine. So a lot of these wastebasket, a lot of these people that are floating around, they've been to so many doctors with all these diagnoses, there might be a unifying concept. There may be a unifying concept out there. Now, we look at the nose on every case. The nose is essential. Now, I always like the analogy. I live in New York City. So the kids live in, let's say, we used to say Greenwich Village. It could be the East Village. It could be Soho. Soho's expensive. They are living in a 500 square foot apartment. If you straighten the walls, it's still a 500 square foot apartment. If I take all the furniture out, it's still a 500 square. My point is that Bill Hang and others, when we expand the palate, we open the nose. When we expand the palate, because the ceiling, you see how narrow that palate is? Really the way to treat these patients is by maxillary expansion. And Bill's going to talk about that in much more detail. That's my daughter's nose before and after. So some people, yes. Do some people need ENT surgery, septoplasty? Yes. And we look at the nasal valves on our patients, and we give the patients mute nasal stents or breathe right strips or nasal cones or anything that you want to give them that simulates what it's like to have an open airway. Because we know that when the nervous system gets too stimulated, when there's not enough airflow, it turns on the hypothalamic pituitary adrenal axis, and we get activation of the limbic system. So if you don't have this book, Breath, please get it. You know, he's been on NPR, he's been in the Wall Street Journal, and of course the takeaways we take from Joe Rogan, because Joe Rogan's a good medical authority, so they told me to make this an evidence-based talk, so I went to Rogan. Nestor says on his show, breathing is essential to recovery, endurance, and performance. If you're not breathing right, you're never really going to be healthy. Breathing allows levers, and that's what I love. Breathing allows levers into the system that you in the IAOMT, if you're trying to detox, if you're trying to do everything, breathing just is going to put one more lever that's going to help you detox the body. Breathing is just adding one more thing into the system that's going to make everything else you do, the mercury removal, the smart, everything you do is going to work better if you're breathing. I guarantee it. It needs to be removed. It's not mystical. It needs to become everyday practice. And nasal breathing is really the way to go. And then Bill Dement, the father of sleep from Stanford, he says, if you were asked to name the most common chronic illness in the US, you wouldn't really think of sleep apnea. Yet, according to well-known sleep expert Bill Dement, no other chronic disease afflicts more Americans than apnea. And by the way, when you look at hypertension, 85% diagnosed. Diabetes, 50% diagnosed. Sleep apnea, 15. So there's 85% of your practice out there, I guarantee you never had a sleep study, never has been diagnosed. That's your how many things are affected. Use the stop bang. If you want to start with a very, very simple questionnaire, you want to go back on Monday, just put the stop bang questionnaire into your practice. Insomnia. You know, if you don't sleep well, you're going to crave the wrong foods. You're going to crave carbs, sweets. Your ghrelin's going to be out. Ghrelin is the go hormone. That means I want to go or eat. Leptin means I'm stopped. The ghrelin doesn't work well. The leptin's not working well. Your metabolism slows down. You get 10 times increased depression, 17 times increase in anxiety, and 5 times increase in depression. So give your patient a sleep test. Sleep hygiene, set your room tonight at 68 degrees is recommended. Use an eye shade. We're in Florida. Warm shower, bath, Epsom, magnesium salts. Turn off the screens. Try mute nasal stents and get a good pillow. You know, the food pyramid was wrong, right? 30 years ago, we should have like 8 servings of grain. Don't stay away from that olive oil. Stay away from that stuff. That'll kill you. But eat a lot of bread. Well, we were wrong. We were wrong. You're supposed to eat a lot of vegetables. Okay. So it's the same thing with the TMJ and the airway pyramid. In the old days, teeth were everything in dentistry. In the old days, teeth were on top. There was no, right? In the old days, Richard, we never even heard of airway. We didn't talk about the airway. Maybe Ricketts did. Now, airway first is on top, and then clenching TM. The last thing we look at is the occlusion in the teeth. And this says, live, make mistakes, learn from your mistakes, repeat steps 1 to 3 until wisdom is acquired. Realize that the wisdom you acquired in step 4 was not really wisdom at all. This realization brings new wisdom. And then repeat. That's life. So at the end of the day, try it for yourself. Go back to your practice. Airway trumps everything else we do. And remember that if this is the patient that came in. Oh, I didn't know that I had sound on this. I didn't tell you that. I forgot. But anyhow, this is James Nestor, and what he's saying is that over time, So you see how much skinnier and how much longer. This is how we looked like about 8,000 years ago. This is about 2,000 years ago. And coming up here is how we looked about 300 to 400 years ago. So this woman represents the sort of facial growth that we had about 500 years ago. As the centuries pass, she starts representing where we are now. This woman represents the sort of facial growth that we had about 500 years ago. This is who I see in my office, this woman. She starts representing where we are now. I don't see any women like that. Sort of facial growth that we had about 500 years ago. As the centuries pass, she starts representing where we are now. This is going to be Bill Hang. Bill's going to tell us how we can do this, how we can get this kind of horizontal growth, how we can do orthodontics that opens the airway. And I'm gonna wrap up. But basically what you see, if a child is a thumb sucker, you don't correct it, it's just gonna stay there. It's not gonna improve with time, it'll just stay there. Do a good examination, look at palates, look at tongue size, do sleep studies. That's kind of what our appliances that we use at night for the airway. We like to align data sets. So what you're going to learn is how to align all these data sets. How do you align the sleep study, the chief complaint, the TMJ radiograph, the imaging, the airway imaging? How do you put everything together and then make a good treatment plan? It's called aligning data sets. And then lastly, you're going to hear about aligning Bill Hang, BioBlock. You're going to learn about different techniques to how to grow the airway, because we think that orthodontics is probably the step and the way to permanently resolve this problem. Your kids will have improved grades, focus, and behavior. Diet's important, sleep aids, melatonin. There's other things you can do. It's all in my slides. And if you need more references or you want to know how to learn more about this and how to do this online, you can contact, somebody that we work with, or you can ask. And thank you very much. It's been a pleasure.